Hello, good afternoon. Like I promised last week, we're going to talk today about continuation of the personality disorder. Today I'm going to talk about cluster B and cluster C. Cluster B is described as a dramatic and emotional disorder. I will first talk about antisocial personality disorder. They are described as sociopathic personality disorder, and the text says it accounts for about 30% of people that commit crime in the United States. They are highly manipulative, exploitative persons. Deception is kind of watchword for them. They have low tolerance for boredom. They seem like they are disloyal, and they also engage in high risk behavior. They have no regard for their own safety and safety of others. Um, their manipulative personality is for they use it for their own personal gains, and if they don't get their ways, they can become hostile if somebody block them. In their management, if they could be admitted, they will become really angry, manipulative, impulsive, and aggressive. So as caregivers, we need to prevent these behaviors like flattering, seduction, and also they might try to instill guilt in caregivers like doctors and nurses. What we need to do is to set clear boundary and state consequences of behavior very clearly to them. We also have to ensure that all staff follow the guidelines, follows uh, the stated consequences. We need to document their behavior clearly, carefully, and teamwork, like I said, is very important. Like everybody taking care of them needs to be on the same, we have to be on the same lines. We need to have our word and our behavior in check. We need to behave the same. We need to carry out setting boundaries the same way. We want to use therapeutic communications, like, clear and open-ended questions and things like that. Also, we need to provide safety for the patients and others. In terms of medications that sometimes they might have to use, there's no, according to the text, there's no FDA approved meds for this condition and the rest of them that I'm going to talk about. But they usually put them on mood stabilizing medications to treat their aggressiveness and stabilize their mood. And also they might put them on SSRIs like antidepressants like Prozac and Zoloft to help them with the irritability, and also benzodiazepine like Ativan. But we want to be careful using that because of the risk of addiction. So the next group is borderline personality disorder that I want to talk about. Borderline personality disorder people, they are labeled, that is, their mood changes very quickly. They can be accelerative, very, but their behavior is not regulated. They are very impulsive, meaning that they don't think through actions before they do that. They can behave in a self-destructive behavior, splitting, meaning that they divide one group against the other, and projection, like they transfer blame to another person, and they can injury on themselves, like cutting. So some of their behaviors. So in that cutting behavior, sometimes it is said, as the text says, it's a method they use for coping when they feel like their pain, their internal pain, is kind of it's kind of so very intense that outside the external pain can help them to kind of remove their focus from the internal pain to the outside pain, and helps them to calm down. So they can do that. So uh, some of those people can have what we call transitional object, like use of comforting objects like blankets and stuffed animals. Uh, in terms of taking care of their management during the period of stress, we need to set boundaries consistently, meaning that all the team needs to do the same thing, carry out the same, setting the same limits and all that. When they have their unusual behaviors, the same medications as above that they give them. Usually they put them on, benzodiazepine to kind of help them to reduce their anxiety or they put them on mood stabilizing medications like Depakote and all that. The next group that I will talk about under the cluster B is histrionic personality disorder. They uh, they demand to be center of attraction. Those are the people in code that they call drama queens. They are very flamboyant, but despite the bold exterior, the book says they have difficulty in maintaining, they don't have like opportunity in maintaining a meaningful relationships. So when we are in their management, therapy is very good for them. Keep communication professional, and therapy helps them to clarify their inner feelings, and they can have individual or group therapy, and also they can be put on the medication that I talked about, like mood stabilizing medications like Depakote, anti-anxiety medications, or SSRIs to help with their irritability. The last one on that cluster B is called narcissistic personality personality disorder. Narcissistic personality disorder is considered to be people. They said they see this more in men, and they have morbid preoccupation of themselves. Like they always, thinking about themselves as number one, which is not a bad thing. But when it becomes too much, then it becomes morbid. It becomes like a sickness. They lack empathy. They feel entitled, feeling of entitlement. But they said, the text says, underneath the arrogance exterior is fear of abandonment. So in our role as caregivers, we need to have a role modeling behavior to be empathetic towards them if they ever seek medical care, because a lot of them don't think anything wrong with their behavior. So if they do, their management will be all that I've talked about in the, like therapy to help them kind of, clarify all those inner feelings and things like that, and their medications if they become aggressive and all that. Then I will go straight to cluster C. Cluster C, the first one is avoidant personality disorder. They are shy because they have a fear of rejection, and they are very reluctant to try new things. And the second one is dependent personality disorder. They're described as people who have low self-esteem, extremely dependent on others, like they have to have approval of others. And in some texts, they said even this group of people, this personality disorder, you stay in an abusive relationship, or if that one relationship ends, they quickly get into another relationship. They always seek approval of the person that they think as significant other before they make decisions and things like that. And the third one is called obsessive compulsive personality disorder. These people are very rigid. They are perfectionists. They must have control over everything. So in their management for all of this, we can have them have like assertive training, especially for the avoidant and dependent. We should approach them in a friendly and accepting manner. And also, therapy, group therapy or individual therapy could help them to kind of, process all those anxiety-provoking situations. For the obsessive OCD, the obsessive compulsive personality disorder, we want to avoid power struggles because they are very they are people that they want to be in control of situation. And in terms of medication, like I said earlier, for this group of diseases like or disorders, there's no like approved FDA medications for them, but in terms of their mood, they can be put on mood stabilizing medication like Depakote, or to also treat their um, irritability. They can put them on SSRI like Zoloft or Prozac, or to manage their anxiety, they can put them on anti-anxiety medications. But lastly, despite their fixed pattern of maladaptive behavior, people with personality disorder can change. Their behavior can change as they access treatment like therapy, medications, and all those. So their behavior can change. And thank you.